Hey guys, and welcome back to another episode of Mondays with me, Dr. Crystal. Guys, I am so excited to make this video today. I honestly don't care if it gets 0 views. I'm making this for myself. So the reason I'm so excited is because my channel has officially come full circle. So if any of you have scrolled way back through the videos on my channel, you will notice that there are some from about 12 years ago. So this is when I was in college, when becoming a doctor was just a twinkle in my eye. I already knew that I wanted to do medicine, but mostly I was just obsessed with basketball. And maybe a certain player in particular. If I'm being honest, I'm still obsessed with basketball, and if I'm being really honest, I'm still a little obsessed with this player, Diana Taurasi. So back in the day, I made a couple videos about her, and she actually reposted one on her blog. And I was just telling my boss the other day that that was like the high point in my life, and it's kind of all been downhill from there. But really, it was probably one of the coolest things that ever happened to me, especially when I was like 19 years old. So anyways, I still love Diana Taurasi. I still love watching her play. Last summer, I was actually out in Phoenix watching her WNBA team play, the Phoenix Mercury, and I actually got engaged outside of the arena after one of the games. So yes, this is my love for DT. By the way, this is the shirt I wore in my video 12 years ago. It's since been autographed. You see it? So 12 years ago to now. I mean, a lot has changed, but a lot of stuff has stayed the same. I'm still obsessed with basketball. I still love Diana Taurasi. I'm a doctor now, and I get to be the team doctor for 2 Division I basketball teams, and so those who can't do doctor. So anyways, the point of this video. So I wake up 2 weeks ago, look on my phone, and imagine my surprise when I read the headline, Diana Taurasi undergoes successful back surgery. This headline is so vague. I was so nervous as I clicked on it. There are a ton of different kinds of surgeries you can have on your back. Some of them are really big, scary surgeries, and some of them are smaller surgeries, but either way, it's a surgery on your back. And this is my favorite player, and I know that at the very most, I probably only have a few years left to watch her, and so this made me very nervous. And so clicked into the story, and it says that she had surgery on a bulging disc. Whew. Out of all the surgeries it could have been, that one, I'm okay with that. They say it went well. They said she'll be back in about 10 weeks. So, okay, can still catch her at the end of the season if all goes well. So today, in honor of Diana Taurasi, I thought we would talk about herniated discs. So as a sports medicine doctor, honestly, sometimes back pain is the bane of my existence. Everybody's back hurts. So I thought when I started working at student health, I might get to escape back pain a little bit because it's a little bit of a younger population. But let me tell you, every grad student has back pain. And a lot of the undergrads too, because they are studying like this all the time. So I deal with a lot of back pain. So what is a herniated disc? All right, so I know that all of you have seen a skeleton at some point in time, maybe at Halloween. You have vertebrae going up your back like this, and in between them, there's these little spongy type things called discs. Don't worry, got a visual aid. Oh my God, this smells so good. So this angel food cake is our disc, okay. All right, so there are essentially 2 parts of a disc. The outer part is called the annulus. The inner part, which is like a jelly, is called the nucleus pulposus. So sometimes due to injury or repeated torsional strain, so torsional is like twisting, you start to get tears in the outer annulus. This is so good. So as this outer layer gets torn, it allows room for that jelly. This is not working how I imagined. It allows room for that jelly to kind of spill out. I'm just gonna put more in there. So the tears let that jelly come out and kind of make a bulge here on the side. Now the reason this causes an issue is because right behind this, the nerves are coming out of the spinal cord. And so this extra junk that's right here can sometimes be bulging so big that it can press on a nerve and cause pain. And so this is when people get something called sciatica, which you might have heard of. The most common spot for this to happen is between the very last lumbar vertebrae and your sacrum. And so that's right where the sciatic nerve comes out. The sciatic nerve is the nerve that supplies your legs. And so a lot of times people who have this will have pain shooting down their leg, especially when they're doing different activities. Okay, stop. What? I had to get rid of the cake because I couldn't stop eating it. So first things first, how do we diagnose this? So when we do our exam, it can give us a very strong suspicion for a herniated disc. If someone's having back pain, specifically if someone is having pain shooting down their leg, especially when we lift their leg up, it's called the straight leg test. If we want to confirm the diagnosis, we get an MRI. So the MRI gets a good look at the soft tissues. We're able to really see that disc between the bones. We can see if it's bulging out and especially if it's pressing on any nerves. So now we know there's a herniated disc. What do we do? So a vast majority, about 90% of these, resolve on their own within about 3 months. So for treatment, we usually start with anti-inflammatories, whether that be NSAIDs or a short steroid taper to try to decrease any inflammation. Sometimes we'll get these patients in therapy, specifically to work on like extension exercises, and sometimes a little bit of traction will help. If that doesn't work and the patient's not getting any better, oftentimes I'll refer them for a steroid injection. And so with the steroid injection, they put the steroid right near the disc with hopes that it'll help it shrink down. Somebody just drove by. If none of that works and there is still no improvement, that's when we start talking about surgery. For the surgery, they essentially go in and remove that little piece of disc that's pressing on the nerve. As far as back surgery, the recovery is fairly quick. Within a month or two, the patients can usually return to moderate or high intensity activity. They said 10 weeks for Dee. I mean, she's going back to play professional basketball. They want to make sure she's 100% because the last thing they want is for her to go back too early and get hurt, because we need her if we're gonna make a run at the championship. All right guys, that is all I have to say about disc herniations. I hope you enjoyed the video today and I hope you learned a little something. If you did, please give this video a like, subscribe if you haven't, and I will see you next week. Guys, Diana Taurasi is the greatest. If you haven't seen her play, wait 10 weeks and then you should go watch her play.